Hello, my name is Brian Hutton, and today I'll be doing my uh, presentation over CPR resuscitation. Thank you for joining me today. So the first thing I would like to cover is going over what the TV idea of CPR is. CPR in the eyes of the consumer world is highly idealistic. The doctor will rush in, begin CPR, frantically pressing on the patient's chest. Oftentimes is not even realistic, where they're not pushing with the consistent rhythm or keeping in line with the realistic rate of compressions or anything along those lines. CPR is another thing is that CPR is thought to be commonly successful, and in reality, it's not. CPR on average only is successful around 15% of the time, with most optimistic statistics pointing to that to be upwards of 30%. And then lastly, the consumer idea of CPR has bred a lot of misinformation, and that's fairly dangerous when it comes to information that could potentially save someone's life. So today we're going to be covering some of what the real information is and how the citizenry at large can help improve the chances of someone to survive a cardiovascular event. So what misinformation is out there? Well, firstly, as we covered just a moment ago, is how successful CPR is. CPR on average is only successful around 15% of the time. That's not incredibly high. There's a lot of different factors that go into that number, but it's an unfortunate reality that we currently have to deal with. The next thing is what steps are actually expected of civilians. Civilians are not. So one of the biggest points is that civilians are not expected to perform what's called rescue breaths. Now, the reason it's commonly discouraged, as in comparison to how CPR used to be taught, is because there's a lot of things that you can come into contact with a person that you don't know, such as communicable diseases. And in order to prevent people from passing along these things, the citizens are discouraged from actually using them without proper protective equipment. Another reason is that the body actually stays oxygenated for upwards of 10 minutes, meaning that oxygen will be continuing to be brought towards the necessary organs without actually having to provide breaths. And another thing is what to expect during and after CPR. The patient's chest will often make a lot of cracking sounds, as both cartilage and ribs are potentially going to be broken. And to be honest, these are signs that actually show that you're doing it correctly. And lastly is when to notify 911. So the distinguishment when it comes to this is that citizens are expected to call 911 immediately, only if they actually witness the cardiovascular event. So if they actually see the person collapse from having a heart attack is when citizens should be calling 911. In contrast, if you see a person who has already become unconscious and is no longer alert and oriented, then you need to actually begin with CPR rather than calling 911 first. And after you've completed 5 cycles, which is roughly about 150 compressions, that is when you would want to call 911. So why is CPR so important? According to the CDC, heart disease is one of the leading causes, if not the leading cause of death in almost every age group. The only age group it not being one of the leading causes of death is 10 to 14-year-olds, and even in this age group, it is the number 6 determining factor in when people actually end up, or it is the number 6 cause of people who or it is the number 6 cause of death. My apologies. Early quality CPR is another huge important thing. It's an important factor in determining the outcome of the patient suffering from a heart attack. CPR has been shown to be single-handedly the most important factor when it comes to determining whether a person actually survives the event. And the more people who are able to help in what's called the chain of survival, according to the American Heart Association, the higher the chance that the patient will survive the event as well. Here's a chart from the CDC, just showing the statistics as to what are the most common causes of death for each age group. You can see that heart disease, as a person enters the geriatric age group, is the #1 cause, and in every age group except for 10 to 14, it is within the top 5 causes of death. So what happens to the body if CPR is delayed? The first thing that's going to happen is cardiac irritability, and that happens within 0 to 1 minutes. Obviously, as it is a cardio event, your heart is going to be quite bothered by the fact that it's not pumping out blood like it should be. In the 0 to 4 minute range, brain damage is not likely, but at the 4 minute range is when brain damage is likely to begin, and when it is going to start having potentially some effects altering that person's life. And in the 6 to 10 minute range, it's very likely. Very few people make it to that point without having some life-altering effects, and more than 10 minutes is irreversible brain damage. So, as you can see, with delayed CPR, the chances of survival for a patient dramatically decrease. So what improves outcomes? The first thing is following the chain of survival as laid out by the American Heart Association. Early compressions, calling 911, and then moving on to EMS personnel and them following through with other advanced life-saving support is what is going to potentially save this person's life. Early CPR and citizens implementing compression only is going to also increase those chances. Last is certification and training. Getting certified and getting the training necessary in order to actually help participate in these events is incredibly important, and being more than an onlooker, being an active part in helping save someone's life. Thank you for listening.